Handling dental injuries in children. Today, I'll guide you through the essential steps to handle dental injuries in children. Let's start with dislocated or loose primary teeth. If a primary tooth is loose, it often heals on its own. However, if it interferes with the bite or poses a choking hazard, it may need to be removed. If a primary tooth is knocked out completely, do not attempt to reinsert it into the gums. Replacing it could damage the developing permanent tooth. Fortunately, losing a primary tooth early usually doesn't affect the child's speech or the alignment of permanent teeth. Moving on to broken primary teeth. It's important to see a dentist as soon as possible if a child has a broken primary tooth. The dentist will examine the tooth for any damage to nerves or blood vessels. Treatment may involve smoothing out rough edges, repairing the tooth with resin, or possibly removing it. Now, let's address dislocated permanent teeth. This is an emergency situation. If a permanent tooth is knocked out, it should be reinserted into its socket as quickly as possible, ideally within 15 minutes. However, if you store the tooth in cold milk, it can be effective for up to an hour. Here's what you should do. Handle the tooth by the crown. Gently rinse it with saline or tap water to remove any debris, but don't scrub it. Then, reinsert the tooth into the socket and have the child bite down on a clean towel or handkerchief to keep it in place. Seek dental care immediately. If reinsertion isn't possible, store the tooth in cold milk or the child's saliva, but avoid water and get to a dentist urgently. For a loose permanent tooth that's interfering with the bite, this is also a dental emergency. The tooth might be repositioned and monitored over time. The dentist may use anesthesia, stitches, or splints, and close monitoring will be necessary, sometimes for months or even years. This tooth might require root canal treatment later. Lastly, broken permanent teeth should be treated as soon as possible, ideally within a day. Save any tooth fragments in tap water, as they may be reattached. If reattachment isn't possible, the dentist can repair the tooth using composite resin. In all cases, prompt action and professional dental care are key to achieving the best outcomes. Please subscribe to the channel for more content. Thank you.